I'm Dr. Andy Kaneps of Kaneps Equine. Today, we'll discuss a colic examination of your horse. Colic is a manifestation of abdominal pain, and it can take many forms. It can be anything from your horse curling its upper lip, to looking at its flank, to severe pain where the horse is unable to stand up, is sweating and throwing itself down on the ground. It's very important that you understand the signs of colic and when you need to call your veterinarian for an exam. Anytime a horse is showing abnormal behavior localized to the belly, we have to suspect abdominal pain and colic. The first steps you need to take if you see that are to pull away the hay and any other feed present and watch the horse a little bit. Taking the horse for just a brief walk may be very helpful, but excessive walking without an exam is not a good idea. If your horse continues to show abdominal discomfort, you need to call out your veterinarian for an exam. The veterinarian will assess your horse's level of discomfort. If it's mild, you and the veterinarian will discuss the history to determine if there have been any changes in the horse's diet, any changes in hay source, changes in the weather sometimes can be associated with colic. Also determining whether your horse has drank its normal quantity of water that day is important. The veterinarian will then take steps to assess the general well-being of your horse with a focus on the abdominal organs. We take a temperature, pulse, and respiratory rate and evaluate cardiovascular function by looking at the gums, assessing gum color and moisture, and capillary refill time to assess perfusion or circulation of the horse. From there, veterinarian will assess gut motility by listening to the abdomen. Normally, there's characteristic large sounds in the normally functioning intestinal tract. Either hyperfunction or lack of function when listening to the belly are abnormal and will be recorded by your veterinarian. From there, depending again on the level of discomfort the horse has, your veterinarian may choose to pass a nasogastric tube or stomach tube by taking a flexible tube down the nose and into the stomach. Doing this is both diagnostic and therapeutic. If, for example, when the tube is passed into the stomach, a large amount of feed material or fluid comes out the tube, that shows that the stomach is distending and isn't emptying. Decompression of the stomach then can be really quite helpful to the horse's pain level. If there's no fluid coming back on the tube, your veterinarian may choose to pump fluids alone or fluids with electrolytes or mineral oil down the tube. Putting fluid material down into the stomach helps stimulate colon motility, so it can be very therapeutic. Then mineral oil or water into the stomach can help lubricate and moisten the fecal content and help encourage its passage. A next step of most colic exams is rectal palpation of the abdominal organs. By reaching and feeling the contents of the abdomen through a rectal exam, your veterinarian can tell whether or not there may be an impaction, such as a distended portion of intestine with feed material, or gas in the intestinal tract, which may indicate a complete or partial obstruction. And that information is added to our record in the full assessment of the horse. A more broad spectrum evaluation of the abdominal contents can be done under certain circumstances with an ultrasound exam, with the ultrasound probe being placed in various parts of the abdomen to assess distension or lack thereof of the intestinal tract, whether or not the bowel wall or intestinal wall is thickened, and looking for excess fluid or even the possibility of hemorrhage in the abdominal cavity itself. Your veterinarian may also obtain blood samples for laboratory testing. And these blood samples are commonly evaluated for PCV or hematocrit, which is an indicator of hydration or dehydration, and also total protein content, which helps us assess those same factors. We can also test for various enzymes that may indicate inflammation and help us identify the potential cause of the abdominal pain. Once the complete examination is finished, your veterinarian will make decisions on treatment. That treatment may involve use of a mild intravenous sedative or administration of other medications that may reduce spasm of the intestine or act as an anti-inflammatory to reduce discomfort. Also, as I said earlier, treating the horse with either fluids or oil down the stomach tube would be considered part of the treatment. The horse is usually assessed for a period of time on farm, and most horses respond to very straightforward, low-key treatment. If your horse doesn't respond to the initial, relatively low-key medical treatment, more intense treatment and examination may be required at a referral center. If that is undertaken, the horse is prepared for shipment by making sure that, if needed, a stomach tube is in place. Also, that correct levels of medication and pain relief are on board for the trip. The goal is to have your horse ship safely to the referral center. Once at the referral center, a more detailed examination may be undertaken, and the horse may or may not be put on more intense medical therapy, such as intravenous fluid therapy. If the horse fails to respond to this more intense level of medical therapy, surgery may be indicated. Those approaches are only undertaken when medical therapy is not effective in stopping your horse's discomfort. In summary, it's very important for you to understand even the mild signs of colic so you can enlist the aid of your veterinarian if needed. At minimum, consult with your veterinarian, describe the signs your horse is showing, and your veterinarian will determine whether or not a more detailed on-farm exam is needed. For further information about signs of abdominal pain and other issues related to the abdomen, take a look at the SmartPak Horse Health Library.